Hi, I'm Dr. Bryce Nelseon, and I am the Chief of the Division of Pediatric Endocrinology and Diabetes here at the Children's Hospital of Richmond. And I am honored today to talk to you about some burning questions that we've been hearing from a lot of our patients and families about how do we handle going back to school and diabetes. I think these are some very important questions that we want to try to address for you. And certainly ones that we encounter every day in our clinic. So the first question is my child at greater risk for getting COVID-19, the infection from the coronavirus, if they have diabetes? And the answer to that question is that no. So having diabetes does not put you at greater risk for getting infected with coronavirus or any particular virus, but it does put you at potentially greater risk, or put your child at greater risk for having more difficulty in the control of your diabetes, or for having complications related to the infection, meaning that it's more likely to make you more sick with the infection. Now, we have learned that with this particular infection, that children actually, as we have heard, have done reasonably well with it and have had more mild cases. But we do know that diabetes is a risk factor for having more moderate to severe illness with this. So we want to make sure that people are equipped to be able to handle this. And I promise you that you will be able to. So the other question is what can I do to prevent the infection? Well, those are the standard things that we've been recommending and following the CDC guidelines. And that is making sure that you appropriately use hand hygiene and wash your hands, either with soap and water or with a hand sanitizer. Certainly make sure that you do that prior to touching your face or to your nose or your mouth. Want to make sure that our children are wearing masks. That helps protect them and other people around them from potentially spreading the infection or getting the infection. Maintaining appropriate social distance and being aware of your surroundings. Maintaining the 6-foot radius is something that's also very important. So those are the things that are really important to help us prevent the spread of this infection. The other thing with regard to diabetes is be prepared. What I mean by this is you want to make sure that you have ample supply of all of your diabetes supplies, your glucose test strips, your glucometer, your insulin supplies, all of the things that you need to deliver insulin, your pump supplies if you happen to be on a pump. If you happen to be on a continuous glucose monitor, you want to make sure that you have enough glucose monitors as well. And the other important thing is make sure that you have plenty of food. And if you're having problems getting access to food, please let our clinic know, because there are food diaries and there are ways that we can try to help with that particular problem. But that's also a very important thing that needs to happen for us to be prepared with this. So the other question is it safe to go back to school if my child has diabetes? The answer to that is yes, it is safe for your child to go back to school. Whether you are participating in remote learning or in-person learning, it can be a very safe environment. The things that you want to make sure that you're discussing with the school is discussing with them what the plan they have for providing appropriate social distance, how to maintain good hygiene, hand hygiene, how to handle if a child gets sick, how will the nurse's station or nurse's office be available to children who have multiple different diseases, including diabetes, and make sure that you're discussing those with the school system, especially in person. But having diabetes doesn't mean that you can't go back to school in person. It certainly means you can. You just want to make sure that you are prepared and that the school is prepared to be able to handle and meet your child's needs. Another thing that is we often get asked is, what do I do if my child is infected with COVID-19 or has been exposed? If your child or anyone in the family has been exposed, then following the CDC guidelines for quarantine are important. So making sure that you're prepared to have a place in the house where you can quarantine those individuals who do have COVID-19 to try to prevent the spread of the infection within the household. If your child does happen to become infected with COVID-19, first thing, don't panic. The next thing is make sure that you are familiar with how to proceed with what we call sick day management or ketone management. And those would be good things to review with your endocrine or diabetes providers to make sure you're familiar with those. Those particular interventions where you're checking blood sugars more frequently, every 2 to 3 hours, monitoring urine or blood ketones to get an idea of how much the body is making ketones in response to the illness, so that you can effectively provide enough insulin and enough hydration to try to prevent that. And if those things persist, then it's important for you to notify our office or your healthcare provider so we can help to see if your child needs to come to the emergency department or for more urgent evaluation. I hope that you found that these questions and answers helpful in terms of trying to help guide your child back to school. We want to see our children back in school, and we can do that safely and effectively for our children with diabetes so that they can be back with their friends and they can be back taking great care of themselves and also all of us. I thank you for your attention and your time, and if you have any questions, be sure to leave us a comment down below and we'll be happy to get back in touch with you.